This is a Chronicle podcast, bringing you ideas in the service of medicine.
Greetings and welcome to Shear Listening Pleasure with your host, me, Neil Shear. I'm a recently retired academic dermatologist. Over my career, I have been inspired by my many colleagues and trainees who are dedicated to helping people with major life-altering skin conditions. Some people don't recognize dermatology as a real medical specialty. Oh, but is it ever? From the many stories of patients and providers, I hope we can inspire others. We will travel across Canada to delve into inspirational contributions to improve the quality of life of others. Very few specialties have as many diverse diseases as dermatology. So without any gory photos, just friendly chats, we will take you into a world behind the scenes, a world of caring, compassion, and inspiration. And of course, I want to give a very special shout out to our sponsors supporting the podcast from Amgen Canada. Thank you so much. We really appreciate it.
With knowledge beyond measure, discussions you will treasure. It's sheer, listening pleasure.
Just to introduce briefly Dr. Afsaneh Alavi, who is speaking to us from her office at the Mayo Clinic in Rochester. And Afsaneh has done it all and is still doing more and has been such a major contributor to so many areas in dermatology, from some of the diseases and gender issues, etc., and emergency help. It just goes on and on. So I don't want to take up too much time introducing her, because all you can do is get something wrong, and then the person has to decide whether they correct what you said, or do they just go ahead and plow ahead in the 5 seconds that are left. So as I promised, Afsaneh, I guess maybe right now, if you could tell us what your position is at the Mayo Clinic, a little bit of what you do, and then maybe take us back to when you first got into dermatology, where you were and how this all evolved.
Thank you so much, Dr. Shear, first for having me here and giving me this opportunity. I'm now a consultant at Mayo Clinic in Rochester. It's almost 3 years that I'm here. And thinking about the journey that I had, it's interesting, the same as many other people, and particularly many other immigrants that have, for different reasons, they have to leave country and build a new life. And I was one of the lucky ones. When I go back, I grew up in a middle-class family. My father had lots of compassion for us to study, empowerment of particularly his daughters in a culture that could be a disadvantage to be a woman. And I grew up with lots of emphasis on compassion and also ambition. First of all, it was difficult to go to medical school because when I was in high school, Iran Revolution happened. Then universities were closed. There was no option of going to university because for 4 years there was no university. But I never thought that it doesn't open up again. I had hope. And I was lucky I got to medical school in a very competitive environment. And when I graduated, also dermatology was one of the competitive fields to go. But I loved it because it was bringing a different discipline together. I think at that time, I didn't have very much idea. I had just some role models. I knew some dermatologists that I wanted to be like them and applied and got into derm. And the first thing when I graduated from dermatology, the newest things were cosmetics. Then I was attracted to cosmetic dermatology, and I was spent lots of my time on laser, Botox, till in 2003 when an earthquake happened. That was a turning point for me to be focused more on wound healing and complex medical derm.
Just going to add to make sure everybody knows that we're talking about your personal early growth and your getting into medical school, et cetera, which is the story that always touches me. When people are getting into that and looking back on the contribution of their parents and their passion for it. That was in Tehran.
Yeah, in south of Iran. I should have said I was born in a small town in south of Iran.
Okay, and medical school was in Tehran?
No, medical school was in Kerman, which is south again.
Oh, yes. Okay. And then with the earthquake, that was in Bam.
Yes.
Okay. So did you practice at all in Tehran?
Yes, I practiced 8 years dermatology in Iran, but no, most of my practice was in Kerman. Yeah, but I did part of my residency in Tehran. When BAM earthquake happened, I just jumped that. It was a horrible earthquake. It was 30,000 people died overnight, similar to what now happened in Turkey and Syria. And my sister is an internal medicine doctor. I went to help, and she said she was always upset that dermatology residency is much easier than internal medicine residency. And our patients are younger and they are not they don't. Then she said, "What are you doing here? You are a dermatologist. What do you want to help?" And I said, "I'm here. I can do stitches, whatever you say." And she said, "You're Botox and laser patient, pay you a lot and send us financial help." And that was what I felt that I want to do more of medical, not that undervalue cosmetic. It's amazing to make people look beautiful, but that was trigger for me just to change a little bit of path.
That's interesting. And then ultimately, though, of course, you did end up in Canada. How did that transpire?
I was trying to do a fellowship in wound healing. And it happened that I was connected with Dr. Sibold and applied for fellowship. It took a long time to be able to come here, but starting wound healing fellowship, which is also an interesting field that I believe there is more of. There is an unmet need. There is a gap still in many places because the eye of dermatologists are critical, are important for wound healing. And many of the advanced dermatological conditions eventually lead to wounds and ulcers. It's good to be part of it. But I was lucky that I came to Canada. I was able to go to this field. And when I go back now to the journey, it was 20 years ago. I'm so glad for my family and my children who grow up here and Canada and dermatology environment. I felt home from the first day.
20 years ago. But of course, you remember all these things so clearly. There's such strong experiences. And, wound healing, to me, has always been attractive because it's multidisciplinary and you really rely on a whole team of people to do it right. It'd be nice to think about where you're going now, but just before that, can you just tell us, because now Justin Trudeau is following in your footsteps and going to Haiti. No, he's going to Barbados, and they'll talk about Haiti, which was different than what you did. So can you tell us a little bit about your experience in Haiti?
Yes. When I was in BAM earthquake, I was asked to help some of the people that they were wounded, and I really couldn't. I didn't have the knowledge. I didn't know anything about wounds. Then when Haiti earthquake happened, I felt I want to go. I want to help. I was there in resident. And Dr. Robert Kerser at University of Miami sent an email that if at some point I wrote a letter to him to go to one of these medical dermatology fellowship programs and wrote that I had experience of being in an earthquake. He sent an email that, are you volunteer to go to earthquake? And I thought it is the time. And I picked up a backpack and some dressings and went to Miami and flew to Haiti. It was 3 weeks post-earthquake and so many wounded patients. And I felt, even though I felt what I couldn't do in BAM, now I can do in Haiti. And it was a great experience. And it shows that in medicine, doesn't matter who is the patient, even doesn't matter do you speak the same language with them. the feeling that you can help them make a difference. And now I had the knowledge to be able to help a little bit. That was a great experience.
There are these things that justify the kind of vision that you have, but also are things you walk away from, and not just being touched, but I think feeling smarter. You start to see these issues under such a bright light, and you really work hard to make that happen. Now, you've had your hand in many areas, in women in dermatology, et cetera. What are your goals now? Now you've done all this, and we're 20 years later into it, and certainly things that we found interesting in dermatology. You wonder why you thought of it really in the old days, but now even more. There's so much to do.
I think lots of things that we are doing and we are seeing, it's mainly because you feel it. I grew up with what I dreamed, the opportunity for women. And in Canada, I saw it. Then even though there are some gaps, but was a huge difference. And you see women in Afghanistan cannot go to school. They have potential. Then when there is a potential, it's amazing to help to prevent what that could happen. And we don't see that extremes in North America, but still there are some area that you feel you have the potential, but you might not be promoted as much as it could be because you are part of a minority, because you are or because you are a woman. Then I thought for me was lots of passion and lots of story behind it to be part of what women in leadership or women derm society are doing, and just joining a great group of people that have the same mission. Their work is to empower women. And it's amazing. Still, I see it in my daughter, this imposter syndrome, so many things that people don't believe on themselves, and they need some support, some mentorship to find their way.
Well said. So in your role now, what are you doing now? What are you excited about?
I think from wound care, I was involved in HS work. That I think somehow it was a great opportunity for me to get involved in the care of patients with hidradenitis suppurativa. And the main reason was they were referred to wound clinic, and then seeing this patient that you have said that many, many times, they don't have minimal things in their life and so much suffering this patient have. I focus now more on hidradenitis suppurativa. We have HS clinic weekly here, but I'm trying to also focus on complex medical derm. We always suffered from the fact that we have to do everything in a short period of time. It's in every healthcare system that we don't have enough time to spend on every patient as much as they need. Now I have, because of a special system that is here and not the same as the rest of US, it's just this institute. But I can spend more time on complex medical derm patient and ability to have access to other disciplines. I'm trying to focus and enjoy this part to do complex medical derm.
That's interesting. When you look at drug development, for example, as therapeutics, and hidradenitis suppurativa is a good example, what a difference it made when industry recognized how horrible this disease is and hoped that there was something they could do. And people stayed together in teams for years, which was unheard of, just because they didn't want to leave it. They wanted to sort of finish at least a major contribution to the care of people suffering from hidradenitis suppurativa. And of course, as a diverse group, there's some people who need just a little small pill here and there, some topical therapy, something like that. But some of the stories you see, you just remember these patients for the rest of your life. You can't believe how they lived like that. Do you feel like we're making, well, I guess a breakthrough not only in the therapeutics, but also access to care? How are we doing on hidradenitis suppurativa?
I think if I look at the two sides of this glass, the empty side of the glass, I think we are still far from where we are in psoriasis in terms of treatment. It seems most of treatment that we have is not targeted, and we are not there yet. But we came a long way. I cannot imagine a patient with HS 20 years ago or 15 years ago, what they were doing. They had nothing but antibiotics and suffering so much. I give so much credit to AbbVie, first of all, to pave the road for these patients. And now it's clinical care, it's attention, it's hope, and it's a light at the end of the tunnel, even though we are not there yet.
It reminds me when you and I met with the Canadian group that said, yeah, we don't really need this. This is the, if you will, the people who are going to be telling the government what drugs they should be approving and access. And you and I went to meet with them because they were saying, oh, no, we don't need this. And we changed them. I mean, we changed them. We showed this is what this disease is. And they're, oh, why I never understood still in some interactions with the governmental agencies. They'll keep asking people who give them the answer they want. And the answer they want is, no, don't pay for it. But, we worked again, industry were heroes in this. And I really have to say that they helped that happen. But when you and I went, it was a great experience to be able to say to them, look, this is what we're talking about. And seeing them respond to say, we didn't know that, but we'll take it back to the agency that does make the final decision. And things started to happen. But of course, it's almost not enough. Getting surgeons in was also a huge challenge, as you know. And all they wanted to really hear from us was that we were really committed. We weren't dumping things and we were really committed. We had a meeting and we invited 6 surgeons and one came and said, oh, you're really serious. Okay, well, we'll work together. So it's been a real challenge. But the good news was that it did show that if you're going to show up, it really makes a difference. Are you finding, I guess, access to therapy in your environment? You're sending people back to other states, you're sending them back to other programs. People can't see your face, but it looks like the face of somebody who's had some major frustration and saying, I know how to make you better. I know what you have. I know how you're suffering. Unfortunately, and maybe you can finish that sentence.
Yeah, I think you pointed very important difference between the biggest challenge that I have here, access to medication. Like we see patients in an amazing center. We do the most diagnostic tests, but people cannot afford to buy the medication. And I think it's a huge issue, a difference between different healthcare systems, also between US and Canada, that access to medication is a huge issue. Then lots of my frustration here is how to write prior authorization letter, how to fight with insurance, pick up the phone, speak with insurance for the minimal medication that I could have it as a compassionate in Canada. Yeah, that's a big challenge, bit different between two systems.
It is a shame in a way that it doesn't matter where you are. There are issues there, and there's the haves and have-nots. And I was asked to give a presentation in the Middle East at one of these meetings. It was virtual. And one of the things that I was asked to talk about was, bullous diseases. And I thought, well, I just started using ChatGPT. I'm not using it anymore. It's too addictive. But I thought I'd just look at my topic and see. And it came up with the usual categories. But then one of the categories that it said I should be looking at as a clinician is access. And I thought, of course, yes, I know that. But to write that down as one of the, 5 or 6 things that actually matter. And I have always taught that in my drug reaction world or drug education about drug therapies is, the efficacy, the safety, the compliance, all these things. Those are important, but access, it's all very nice, but if you don't have the access, is there a very strong advocacy group sort of in the United States in terms of trying to get access, or is it just sort of bits and pieces?
It is lots of advocacy group. AAD already works, American Medical Association, Hope for HS and HS Foundation are working for the access. It's lots of efforts, but when something is difficult, it's difficult even when you're with your efforts. Some of that, it's lots of effort, but access to medication is a big issue. Price of medication is crazily more expensive than other countries, which sounds like some part of it is a false price, and who can bring it down, I don't know.
Yeah, I know. I also used to see people with some bad diseases, and they were, praying that we could find a therapy for it. I said, you should be praying for getting coverage for the therapy. We've got lots of therapies, but there's only so much you can do, and there's no way people should be disadvantaged. The patients themselves very often have become very strong advocates, which is really good. But some of them are so sick, there's no way they can do it. So what are you focusing on? There's so much going on. What are you moving towards yourself in this area?
Yeah, one of the area that now I'm working, there is a big gastroenterology practice here. Then we are working with gastroenterology team, particularly for HS patients that has IBD or has lesions that are sometimes difficult to differentiate. Lots of our research now is focused on that I'm hoping we get some result out of it. That's the main thing. Also, I had the opportunity that here work also with Elizabeth Phillips from Vanderbilt. Then we are putting together a large database of DRESS syndrome patients here and looking retrospectively at that patient. Here, in addition to inpatient, outpatient clinic, I do lots of inpatient too. And then it's a good opportunity to see lots of drug reaction patients and also considering the huge transplant clinic and cancer management here. Then patients that before I wasn't seeing as outpatient, now it's interesting to see this group of patients, and it's a learning opportunity. Then the journey that I started is not done yet.
That's a good point. I mean, what you're describing there is very exciting. A few of them, people, and you may have heard in the podcast, you're sort of getting ready to retire now, aren't you? But they're just focusing more on the stuff that matters, and they're all in. They are totally committed. And once you get them talking about that, they get so excited about it because, once you start getting rid of all these little things that are slowing you down, it's just nice to be able to feel that despite all the challenges that you really can make some major contributions, and these things are getting so much easier to share information. There's so much I want to ask you about that. But just a pet peeve of mine always has been clinical trial reports. So when clinical trials are published, almost every trial that I was involved with over the years, when I actually saw it published, I thought, I have no idea whether they got that information. That's not anything that we saw in any of our meetings. And I'm not saying they were lying. I'm just going, how did that happen? But that's not the point. The point is a clinical trial, its only purpose really is to get approval. That's its purpose. It doesn't tell you how to treat a patient, not really. And people misinterpret all these results in many ways. And I think we're moving away from that. I think we're going to be getting to something that's a little more thoughtful. It would be nice if, payers could say, we'll pay for this long and then we'll reevaluate in a year and see what the outcome has been. There's so many things that could be done that are not that harsh. But whenever you do that, whether it's with payers or government, the rules are this. Okay, but that doesn't mean we have to do that. We still have to have some freedom. But, you're making just a difference in all these areas. And I can see when you talked about it, you're just so excited about all these things and all these groups. I mean, think of all these things and all the other talented people that you're working with, like Elizabeth and other people who really make it happen. It does look, at least when you meet people from the Mayo Clinic, that the clinicians, both on the surgical and medical side, I think are really just very excited about what they're doing. Is that fair?
Yes, and I think we are in an interesting time for dermatology too, that there are so many new things coming. You feel that we are in a very important field. We can make a difference in life of many patients. We can bring a smile to face of many of these patients that come to us. It's not, you feel that in dermatology, we cannot make a huge difference. I think I had that feeling when at the beginning, years back, got into derm, that some people are in cardiology are doing very important work. I have worked with less stress and I'm just prescribing creams, but dermatology is not that field anymore. We are making a huge difference. And at certain period of your career, I think now what is really matter for me is that I enjoy to make a difference. I enjoy for every single patient to be happy to leave. Not that you can make every patient happy, but just do the best that you can, and no other factor affect your decision for the treatment for the patient, and have patient trust. I think when we come to work, that satisfies us, and also working with colleagues, with training. That's a good age time of your career. There are not lots of other things that affect your life. It's you value more.
Yeah, true. I mean, some of the drugs we have, and now we're going back to a lot of older drugs. You keep seeing clinical articles are coming up about drugs that have been around for a long time and using them in slightly different ways now, which is great. But you want the right drug to match with the right patient. And it isn't the disease, it's that patient's genetics or whatever markers or whatever like that. We keep wanting to have this precision type of therapy. Say, well, look, according to these markers, we know these 3 drugs might work, and here's the way we'll go through it. And we're getting there. But I do feel like, it's on the horizon. It's on the horizon. It's not just helping people that way, but it's economically reasonable. It just sometimes, I think the regulatory bodies will keep up with this, but we still haven't broken through in some of these terrible diseases.
And clinical trials made a huge difference too. I know we don't know a better way yet, but if we didn't have a standard way of trying this medication, we had no way to bring so many treatments in short period of time, and a platform that investor be able to invest on it. When you put yourself in the shoes of a parent that have a kid with epidermolysis bullosa or a kid with HS, you can imagine that how important is even any treatment that make a little difference in life of these children or adults. It is a tough situation, and I'm glad that now trial made it possible that we have some options.
Yeah, it is true. Well, it's nice. I mean, hope is always important in all these conditions, and you don't want to take people's hope away. People say, can you cure me? And it's like, well, my goal is the same as your goal. I want you to be completely healthy. We just have to start working on it bit by bit. And they just want somebody to be on the same team with them. I used to get into philosophical discussion about how cure, so it doesn't make any sense. What cure? What does that mean? But that's not the point. The point is we're on the same team and we're trying to fix you. And as you're in a position with a lot of powerful people and also a lot of people who are caring can make a difference to at least get people in the right direction and in the right state of mind, as well as their family. And some of these diseases like hidradenitis, I mean, you don't exactly talk to your family about it. You can tell your family you've had cancer, hair loss, things like that. Even hair loss, people don't like talking about. But that's another thing. People carry this burden of the other life that they lead. And, well, come on in. Why don't you come in swimming with us? And that's like the scariest thing in the world. They're like, no, I don't even want to be put in that position for something even simple. We see a different side, which is one of the great things about dermatology. I think we get to really see what people's lives are like and what it means to them.
And you reminded me of so much that you have done when we went together for this HS drug approval to so many of these meetings. It is amazing that people like you who have experience, who know how to speak with these regulatory people or people to bring just what's going on in the clinic to the eyes of people who make the decision. And I just remember that so many times you came and mentored all of us. And for me, it was just so amazing to look at how you deal with this and learn from it. And that's amazing to make lots of people easy with bringing this access sooner to our patients.
Thank you, Afsaneh. That's very kind of you. You've done so much. Is there anything else that you wanted to bring up? Because I know we've talked on a lot of topics, and I think the theme is there. I mean, the theme is there about advanced medical dermatology and the kinds of things that we can do, as well as other people as part of a team, and how much it means to patients' lives and their families and their children. These diseases are not just, you've got a sore toe and nobody else does. No, these are really serious monsters in your life.
No, just I am grateful for the opportunities that I had, mentors that I had in my life. And I don't see the journey is over. Still a lot that we can do. Yes. And thank you so much for giving me this opportunity.
My pleasure. And thank you for getting me into some of these meetings and the experiences I had there. It's really amazing when you see a really diverse group of people working so well together for things like wound healing and the impact of that, when you look at, was it a talk recently about Ukraine and what some of the people at our hospital who are working there now in Ukraine, and they showed some of the traumas like you saw in BAM and in other areas, but oh my God, the bits and pieces that are missing from people. And then to have somebody who cares about that and manages to put them back together in some way. It truly is like the Humpty Dumpty thing, that the egg falls off of the fence type of thing, and people are suffering so horribly. So there's certainly a lot of wound healing that's needed out there. And then there's psychological healing and so much. So, what you're doing is just such important work. And I'm glad that you're still so passionate about it because it's so important. If you're just getting into dermatology now and you're wondering what wound healing is about, then this is what it's about. And somebody like Afsaneh Alavi is the kind of person you want to talk to. Absolutely.
And Dr. Shear, I remember that we were in a meeting, somebody showed the slides and you said, oh, you wrote this word with spelling mistake. Was Afsaneh creating this slide? Because that word I always make severe. I missed the E at the end. And always it's a joy working with you, how you see the small with your smart, how you look at the small points and creating a point that it's so sweet. And it's always a pleasure to work with you.
Thank you, Afsaneh. It's always been a pleasure working with you. And I hope that you just keep doing all these wonderful things. And hopefully one day you can go back and give talks all over these places in the world that nobody wants to go to right now, because it is fun to meet your colleagues there and to see what you can do for patients. I remember when I was in Tehran, I asked the guy who was the head of Razi if I could go to their clinic, and he thought I was joking because everybody there is for cosmetic stuff and things. I said, no, I want to go. So it was on the other end of Tehran. And so it was beautiful weather. It was sunny, clear, no fog, no smoke. It was after a long rain and a whole bunch of things.
And I told you that you have to stay with me, but suddenly you disappeared.
Well, we went to their Razi. Razi was amazing. I mean, people's passion. And when they were building a new building at the time, I have a feeling they were going to lose some of that interactivity. But the diseases they saw were tremendously horrible. But the inpatient stuff and the care and the passion of the nurses as well. I mean, the whole team just comes alive. But when you see some of these horrible cases of leishmaniasis, et cetera, I mean, there was nothing they could do. And they had access to almost everything. I was really amazed. But what do you think? I said, well, this is where I would come if I was sick, because it's amazing. I mean, from laser kids to doing all these things. So there's a lot of wonderful stuff going on in the world in dermatology. And that's why things like the World Congress are a place where hopefully people can come there and share those. I always found those experiences, people line up to hear all the clinical trial results. That's the big draw. I don't care about that. I wanted to hear what was going on in some clinic in some hills in Mexico, and what was going on in areas like Colombia, places where you're just not going to be biggies, Central Africa. That's what you wanted to hear about. And those people doing that work are also heroes. Unbelievable what they do and what they recognize, and how the physical and mental issues that they have to deal with from themselves, just to protect themselves, if you will, and yet they're out there doing it. There are a lot of heroes in dermatology. And I'm just going to say you're one of those. You're one of those heroes in dermatology. So thank you for all you've done and for your global perspective as well. It just means so much to the world. So thank you, Afsaneh.
Thank you so much. And I think what you brought, it's such important in diversity, because it's for people who travel a lot and see the world. They have been in Japan, they have been in Philippines. They see that people are different, but all are human beings. And that gives a tolerance. And it's amazing for young people who start to plan to travel. This is an amazing gift that we have in our field, to be able to go and see different people, see what is going on in other places, that there are differences, but we get to the point that be able to tolerate these differences in our own environment too. And thank you so much, Dr. Shear, for being such a great mentor.
Welcome. Thank you. And thank you for all you're doing. Just been very kind of you to take your time to talk today, and I really appreciate it. Take care of yourself.
Thank you.
If you enjoyed this episode of Sheer Listening Pleasure, please do share it with your friends and colleagues. On our next episode, Neil will chat with another guest from the world of dermatology. To subscribe, go to www.derm.city or find the SLP podcast at Apple iTunes, Google Podcasts, Amazon Music, Stitcher, Spotify, or, really, wherever you get your podcasts. The producer is Jeremy Visser. Research for this episode came from Cristela Tello Ruiz, John Evans, and Kylie Rebernick. Support for this podcast comes from Amgen Canada. Amgen Canada serves dermatology patients throughout Canada by delivering vital medicines to them. In addition, Amgen contributes to developing new therapies or new uses for existing medicines, in partnership with many of Canada's leading healthcare, academic, research, government, and patient organizations. Today, tens of thousands of Canadians use Amgen medicines every year. Learn more at www.amgen.ca. Send your comments to slp@chronicle.org. Until next time, be well.